The chief executive said there are no plans for now to impose a vaccine mandate on elderly citizens, but said she found it sad that some family members have blocked them from getting a jab. Carrie Lam also rejected lacking forward thinking and pointed to a sewage surveillance program for catching 23,000 infections. Joanna Ho reports.
At her daily press conference, the chief executive rejected suggestions that her government has been reactive instead of forward-looking in formulating COVID policies. Carrie Lam cited a massive sewage surveillance scheme which covers the households of 5 million people and admitted it's costing quite a lot of money. Environment Secretary Wong Kam Singh, whose bureau is spearheading the program, said restriction testing declarations have been made on around 180 premises since late January. Around 23,000 infections were subsequently found, a detection rate of nearly 10%. He added the viral load in sewage samples has been closely in line with infection figures 4 days later, meaning the test can help authorities predict the upcoming trend. On the other hand, Lam denied the current round of social distancing measures, which came in mid-February, were too late. She insisted similar rules were already imposed in January.
The intervening Chinese New Year has been most unfortunate for Hong Kong because despite all the warning from myself, the Secretary for Food and Health, and all the social distancing measures, the reality is during the Chinese New Year, there have been a lot of cross-family gatherings. And as a result, this highly transmissible Omicron was spreading like fire.
She also ruled out mandating vaccinations among the elderly by law. Around 1 in 10 care home residents will not be getting a jab after their family members tendered written notice blocking the inoculations. The chief executive said it was sad to learn that some people still refuse to let their elderly family members at care homes receive a COVID vaccine. She also asked for the media's cooperation to promote the importance of vaccinations instead of focusing on 1 or 2 deaths after getting a jab. Joanna Ho, HKIBC.